There is a lack of mental health care services in the public sector. Selangor Mental Health Program SEHAT's Dr. Muhammad Adil Zainal Abidin says currently there are only at least 500 registered clinical psychologists in the country. Many choose to serve in the private sector, worsening the accessibility and affordability of public mental health care.
We definitely have a limited number of clinical psychologists. Currently, we have about 500 to 600 registered clinical psychologists in Malaysia. And if you break down the number, certainly the number that service in the public sector is diluted, because from the 500 to 600 clinical psychologists that we do have, some are in the universities, some in the private sectors, and some in the government sectors. So the consequences that when you have a small number of clinical psychologists, the waiting list become longer, and the number that serve the public is smaller. So the shortage, the absolute number of clinical psychologists, that is very small, and the uneven distribution of the clinical psychologists across the service further contrast the shortage of clinical psychologists in Malaysia.
He also highlighted issues with remuneration for clinical psychologists within the public sector.
And another problem is that in the government sector, I think the remuneration package for clinical psychologists also is not enticing, because, as I mentioned before, clinical psychologists, they have a master level. But when they absorb into the government service, they were offered at a DS41, even though a T7 salary package. But master at DS41 level, that is not enticing for them. That's why a majority of them migrate to the private sector.
Tackling the issue, he says, must begin with addressing the shortage of workforce in the sector. He also urges improved healthcare financing to ensure accessible mental health care for all Malaysians.
To increase the equity of access to mental health care service, as we discussed the issue before, is to increase the number of workforce in the mental health services. So across the specialty, not only clinical psychologists, but counselors, psychiatrists with such specialty. So when you increase the absolute number of mental health care professionals for all these specialty, indirectly we increase the ratio to the public. And because mental health care service is not only clinical psychology, so there's a wide array of healthcare professionals that can provide the services. So first is to increase the number of workforce. Secondly, I think is the health financing as well, because as I mentioned before, there's a lot of clinical psychologists or mental health care professionals in the private sector, but most of these can be reached only those who afford out-of-pocket financing. So what the second strategy that we can do to increase the access to mental health care services is that from the private insurance sector to increase the insurance coverage, eliminate exclusionary policies, to increase the continuum of care, inpatient or outpatient in their insurance policy, so that not only those who can afford out of pocket, but those who have their insurance policy can, be covered their mental health care services.